obviously the more you test, the more you're going to pick up. So increase in testing is going to give you increases. But there is no doubt that there are more infections. And we know that because the percentage of cases, of the cases that are tested that are positive, is increasing. Therefore, unequivocally, you're seeing truly more new cases. In addition, we're seeing now more hospitalizations, which lag behind infections. And we're starting, and we'll see, though not as much as we've seen, very likely more deaths. So clearly there are more infections.
That was Dr. Anthony Fauci's warning about the increase of coronavirus cases in the U.S. during a discussion with Georgetown University yesterday, which was co-hosted by our next guest, Mo Elleithee. He is the founding executive director of Georgetown University's Institute of Politics and Public Service. Also with us, columnist for The Washington Post, Karen Tumulty, and infectious disease doctor and senior scholar at the Johns Hopkins Center for Health Security, Dr. Amish Adalja. Great to have you all on board this morning. Mo, I'll start with you. What did you learn from Dr. Fauci yesterday about where we stand? And did he have any response to what appears to be an effort to discredit him by the White House?
No, it was great to have him. And he seemed eager to talk with the students at Georgetown, and they were incredibly eager to hear from him. I think there was a real hunger to hear more from Dr. Fauci. I think there were a couple of key takeaways. One, there were maybe at least three places where he broke a little bit from the administration line. One, the clip you just played on sort of how bad the pandemic is right now, and the fact that it's not all attributed just to testing. Two, there was a real disagreement, I think, on school reopening. He didn't seem anxious to call on every district to reopen immediately, that it should be left up to each locality based on the situation there. And then three, there was a disagreement on the World Health Organization, where he said there may be problems there, but it's better to fix from within. But I think one of my biggest takeaways was that question on trust. You know, there's a lot of bad information out there. There's a lot of politicized information out there. There's a lot of arguing. And so I asked him, you know, with all of that, people are confused. Who should they trust? And he kind of chuckled and he said, I get why people are confused, but trust the science, trust the medical doctors. And I think I'm one of them. And I thought that was a really powerful moment.
Karen Tumulty, in your latest piece for The Washington Post entitled Trump and His Minions Are Trying to Destroy Fauci, no wonder the U.S. is doing so poorly. And you write in part this: Fauci, unlike Trump, is willing to recognize and admit his missteps. Trump, who is allergic to admitting error, has apparently decided that he doesn't want to listen to Fauci's expert advice anymore, if in fact he ever really did. But as for the rest of us, we should be learning and adjusting as Fauci does. It could mean the difference between life and death. And Karen, you know, I just remember that coronavirus briefing where the president was talking about injecting bleach into the body. It was one of the low points of what's been, what many believe, a very botched and dangerous response to the pandemic. And yet Dr. Fauci now is the focus of this campaign to undermine him. Is your belief that this is just to assuage the president's ego?
Well, certainly when you have something like fewer than 1 in 3 Americans saying they can trust the president on this, and 70% of Americans saying they feel they can trust Fauci, yeah, there's probably some poll number envy in here, as there always is. But I do think that, you know, Dr. Fauci's experience, and I've talked with him about this in the past, his experience with the AIDS epidemic was it took a while to figure out what this was and who was vulnerable and what behaviors could stop it. And in many cases, as Dr. Fauci was leading the fight to figure out AIDS and to find treatments for it, government would interfere. There would be big debates over whether this was a moral question or a health question. And should we test everybody, but that might drive people underground. So Dr. Fauci knows that you don't know everything at the beginning of a situation such as this. You learn and you adjust. And, it's ironic that what the White House is criticizing him for is underplaying the threat early on, which is something that the President of the United States still does practically on the hour.
So, Dr. Adalja, I want to ask you about this new story about the CDC being bypassed now with information sent directly to this new clearinghouse from hospitals and cutting out the CDC in some ways. But let's pause quickly and just take a snapshot from your medical perspective about where we are. We've seen these rising cases and hospitalizations in Texas and Arizona, Southern California now having to close, the state of California having to roll back on its reopening. South Florida is a place of great concern, Georgia, South Carolina. Where are we right now in this coronavirus crisis?
In many parts of the country, we're not in a good place. None of us expected in July we would still be facing some of the same problems we faced in March. Testing delays, bed capacity issues, worrying about personal protective equipment. And it didn't have to be this way, but it's clear that people continue to want to make the same mistake over and over again and not put in place the simple infrastructure of testing, tracing, isolating, and maintaining hospital capacity. That's been the whole story of this pandemic. And it's something that most of us back in January thought the United States would get right because we were supposed to be the most prepared country for a pandemic. But clearly there's not political will to be able to actually do the simple core function of public health and government when it comes to an infectious disease emergency.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.